to the rehabilitation after such a difficult process of treatment. First of all, I would like now to invite the representative of the Health Ministry of the Russian Federation. The Health Minister was unable to come, and she regretted very much this fact. Therefore, with us we have the head of the department there, Professor Rumyantsev. Good afternoon, dear colleagues. I'm very happy to welcome you once again from this stage. On behalf of the Health Ministry, I would like to say a few words about the organization of care of children with hematological and oncological diseases, about the modern status, about the trends and prospects for the future. In the profile of pediatric cancers, we see the predominance of the lesions of the immune system and lymphoid tissue. And therefore, in the management of these category of patients, there should be some specificity. There are certain trends in the area of cancer epidemiology, and we see that some of the indicators steadily are increasing, and therefore we have to improve the provision of care to such patients all the time, with the inclusion of all modern achievements of fundamental science, of translational research and practical care. The services given to pediatric cancer patients are regulated by the orders of the Health Ministry. And there are documents on the organization of the patient management. Rules are set for the activities of the treatment centers, of diagnostic centers, with proper description of all the functions of all the units and subunits that are involved in the treatment of these category of patients. In the Russian Federation, children who have such diseases are treated in multidisciplinary hospitals, in federal health facilities, and some steps are made to build up new dedicated or specialized centers. The treatment of cancer is high-tech care, which is rather costly, particularly when we speak of the innovative approaches to treatment used not just to save the life of the patient, but to prevent disability. And care of such patients is listed in the high-tech care list, and the funding of this care has increased. For example, the volume of high-tech care in pediatric oncology has doubled over the last few years. In order to ensure access and improve quality of care, we have been intensively introducing advanced method of diagnostics with the use of novel machines. A lot is done to train professionals, organize dedicated departments, centers for bone marrow transplantation, and so on. This allows us to improve the outcomes and treatment results. To diagnose oncological diseases in children, various tests are used: molecular, genetic, cytogenetic, and other types of tests. For example, nuclear medicine methods and so on. In the Russian Federation, we use both regional and foreign protocols to treat malignancies in children. The use of modern protocols includes polychemotherapy, surgical treatment, various types of radiation therapy, including external beam radiation, cyberknife, gamma knife, total body radiation, and so high-dose chemotherapy with subsequent autologous transplantation of hematopoietic stem cells, immunotherapy, and other modalities. All this allows us to improve the survival rates, and now we can boast of rates that are similar, even superior to those of foreign centers. For example, in the treatment of a number of diseases, considerable progress has been made, including lymphoblastic leukemia. Now we have survival rates of higher than 80%, and adjusted for the whole patient population, this will be quite a serious improved. Hodgkin's lymphomas, nephroblastoma, more than 90%, and so on. So the Russian Federation supports more than 10 prospective collaborative studies. The researchers in the area of ALL, non-Hodgkin malignant lymphomas, non-related and haploidentical transplantation of hematopoietic cells are widely used. Now we have more than 1,200 transplantations already done. For example, in Moscow and in Samara, we have the state-supported banks of umbilical blood, and they have more than 10,000 typed samples in them, and the history of success of transplantation with the use of material from this bank is quite long. We do pay a lot of attention to improve the infrastructure in the dedicated centers and build new ones. An example of this can be found in the opening of a new complex of buildings of the Federal Center of Immunology and Hematology, named after Dmitry Rakachev. It meets all modern requirements in terms of providing care to children with hematological and oncological malignancies. Here we see the implementation of multidisciplinary approach in real practice based on science, on cell homeostasis, and correction of disorders based on molecular hematology. The center now treats more than 7,000 patients a year, and this is a very good contribution to the development of care of children. Currently, another construction is underway for Pediatric Center of Oncology and Hematology of the Cancer Research Center named after Blokhin. And this research institute has a higher repute, and very soon it will get another addition in terms of infrastructure and the personnel that will expand access to high-tech care for many patients. We also work to improve the rehabilitation component. Now, today, we have long-term survivals of cancer, and therefore, we are more focused on their adequate rehabilitation. And at the Rogachev Center, the Russian Field Rehabilitation Complex was incorporated to support patients with oncological and hematological diseases. And this experience will be capitalized on, and similar efforts will be made in other parts of Russia. Palliative care is not ignored, and we create the infrastructure for palliative care. We try to improve the regulatory basis for this category of patients, particularly in terms of treating chronic pain in such patients and in some other conditions. Of course, all this requires joint efforts of physicians, and one of the organizers of this event, the National Society of pediatric oncologists, hematologists, now has in its ranks the majority of specialists working in the region and is an effective platform to improve both educational programs and to draw new programs of therapy. The Society of Pediatric Oncologists also actively works in this area. So, to introduce new technologies in the provision of care and treatment, and the necessity and possibility to modify the existing standards of treatment, Russia adopted last year a change into the federal law on clinical approbation. This change allows to introduce new therapeutic programs as well as diagnostic algorithms based on the use of already registered drugs and medical devices. But through the mechanism of clinical validation, they can now be regarded as a new standard of treatment much faster, thanks to this change in the legislation. We understand that oncology and hematology, particularly pediatric oncology and hematology, are a high-tech area of medicine. It requires a multidisciplinary approach, a very accurate tuning, and of course improvements are needed all the time. The ministry does not ignore this necessity and tries to do everything possible to introduce new technologies and to create hardware infrastructure to improve the quality of care with better organizational support, starting from the stage of diagnosis and complete rehabilitation. So now I'd like to once again welcome the Congress participants, and I would like to say once again that such events become the basis for all of us. They allow us to make another step forward or even a big leap in the development of technologies, I would say. And this Congress held in Moscow, SIOP Asia, will actually lead us to the adoption of some breakthrough technologies that we'll be able to use here in Russia as well. Thank you.